Was there anything else specifically that may have stuck out to you? Like, for example, I know that we specifically covered, there was a few trials that involved blood biomarkers, especially with p-tau 217 and 181, as well as the use of regular vaccinations for the flu, reducing AD incidence in later in life. Can you just talk a little bit about that? If anything that stuck out to you that looks extremely promising for the future?
So I think that the biomarker things are hot, and I think everybody would agree with that. You know, we're now seeing the very real probability of seeing a biomarker to be deployed, plasma biomarkers to be deployed in clinical applications within the year. When you look at the fact that, you know, doctors don't feel comfortable making diagnosis. Every company, and if you look at all the corporate symposia, every company is worried about developing these very large and expensive monoclonal antibodies, depending on physicians who can't diagnose these conditions to diagnose these conditions, right? The reason I say this to you is that, you know, if you had a blood-based biomarker that was like a PSA for prostate cancer or a hemoglobin A1C, doctors at least would say, okay, this is an abnormal value, maybe we need to explore it further. Especially if they have an abnormal value and their mini mental is 10. Okay, you know, maybe I need to explore it further. My point is that I see the plasma biomarkers moving into the clinical applications fairly quickly and adoption fairly quickly because it'll improve comfort level. You know, what's exciting to me about the 217 and 181 and NFL data is it correlates very, very well to autopsy data and very, very well to imaging data. And that makes it really confident. You can improve your confidence that you're really measuring target pathology. You know, because the question is when you have a lab value, are you actually measuring anything in the brain? Does it, what you're seeing on the blood test and the brain have anything to do with each other? So these two findings really boost confidence. And so I think that's a huge deal.